If you're a healthcare practitioner treating chronic tick-borne diseases, you already know how overwhelming it can be to navigate diagnosis and treatment. The complexities of co-infections, the lack of standardized testing, and the uncertainty in where to start can lead to more questions than answers. This video is for you if you're looking for practical guidance to simplify this complicated process and to improve patient outcomes. By the end of this video, you're going to have a clear roadmap to approach chronic tick-borne disease diagnosis, the confidence to choose the right test, and a step-by-step approach to treating multi-pathogen infections, giving you the confidence to manage even the most complex cases. Every day spent guessing or hesitating can really delay treatment. This increases the risk of worsening symptoms, further chronicity of the infections, and patient frustration. You owe it to your patients and to yourself to get this right. So the first hurdle is often figuring out where to begin when faced with these chronic, complicated tick-borne disease cases. There's a myriad of symptoms and potential pathogens, which makes it so easy to feel lost at first. Our goal is to create a strategy that simplifies all of this chaos. Many practitioners struggle to decide which tests to order because the symptoms often overlap between infections like Lyme disease, Bartonella, and Babesia. You're just going to start with the local lab and you're going to get what the insurance covers. These more expensive tests might not be the right answer. To some extent, that's true. The issue is when you're waiting to order the right test, you're often delaying results. And I'm not saying order all the mega panels that cost thousands and thousands of dollars, but what I'm saying is often, at least in my practice, people are coming to me to get the right answer. And often this means in the most challenging cases, people who have been sick for months and even years with no clear diagnosis. The big issue becomes if you wait too long to pinpoint the primary pathogen or you miss a co-infection, this means they're either going to get a delay in treatment or you're going to prolong their suffering, and ultimately this complicates recovery. This is why a solid, evidence-based starting point to lab testing is crucial. My recommendation is to go with a lab that has FDA approval. And what you're going to find is that this means that the FDA, while they're not perfect, they have looked and they have found that these labs are getting the right answer more than anybody else. Like 99 to 100% of the time, they're getting the right answer, right? So the thing is, if you even go look at your local insurance-based lab, most of them do not have FDA cleared testing for Lyme and these other pathogens, right? Everybody's like, as if they do, but they don't. So look for a lab that has, the highest level of certification, but also has FDA approval, because this is so important. And I'm not saying, again, that the FDA is the be all end all, but what I'm saying is when you're able to pass that level of rigorousness to the point where they start allowing you to put things like a 31 and a 34 band into your immunoblot, this is game changing because we know that this is super accurate. Patients come to me wanting answers and results. They don't want to be like, oh, what do I have? Let's dink around for a couple of years. What I want you to do is start to feel confident in what you're doing so that you get the right tests. So you need to get the most specific tests out of the gate, because otherwise you're just, wasting time and you're prolonging their suffering. So when you use a structured method that really allows you to look at these high-level tests, it's going to save time, it's going to save money in the long run, and it's going to give you clarity so that you can alleviate your patient's suffering as soon as possible. So now that we've established a diagnostic approach, the next step is to really consider co-infections. Tick-borne diseases rarely show up in isolation. Co-infections like Bartonellosis, Babesiosis, Mycoplasma strep, even mycotoxin illness often present together. And whether they're tick-borne or they're just concurrent co-infections from the community, each are influencing the patient's symptoms differently. This overlap can really confuse you and the patient about what's really going on, and then what are you treating first? So then I go back to point one. This is why you need a really effective diagnostic strategy, because what you're seeing is a lot of the symptoms start to overlap. And when they overlap, it just makes it that much more difficult to decipher. So get high quality testing, take a really good history, do a really good physical, and understand that co-infections can blur the way things look, both your test results and your patient's symptoms. So when co-infections are involved, your patient might experience a wider range of symptoms like fatigue, joint pain, brain fog, and other neurologic issues. and they don't always respond predictably to treatment. And this is one of the biggest challenges we face in our field, is that everybody wants it to be like, oh, you get Lyme, you get these 5 symptoms. If you get Babesia, you get these 5. And if you have Bartonella, you get these 3. The reality is, when you do these, you're going to get all those symptoms combined, and then you're also going to get new ones and overlapping symptoms that are confusing, making it harder to diagnose and harder to treat. So you have to be on the lookout for co-infections, because one pathogen might mask or exacerbate the symptoms of another, making it harder to gauge treatment efficacy. And what's even more challenging is that co-infections can change how your patient responds to your standard Lyme treatments. So the thing is, you can't always treat these infections in isolation. Treating one infection may worsen symptoms from another infection. And if you don't have a coordinated plan, patients can feel like they're constantly treading water and they're not improving fast enough. And by addressing the most severe symptoms first and treating co-infections based on their dominant symptoms, you can ensure that your treatment plan is both effective and manageable. And I'm not saying treat everything all at once. I'm saying have a strategic plan, but allow their body to tell you what it's prioritizing. Treating that most severe things first is often the place to get started. And then you'll be balancing therapies to target multiple infections concurrently so that you can reduce patient discomfort, and it ultimately leads to faster recovery. And so now that you understand the complexity of co-infections and the need for appropriate diagnostic testing, let's discuss one of the other sort of elephants in the room when you're treating chronic tick-borne illnesses. And that's how to protect yourself and your practice when you're treating these cases. Treating tick-borne diseases can be tricky, but not just from a medical standpoint, but also legally. When you're in a situation where the guidelines are vague and the treatment paths aren't always clear-cut, you might wonder how to protect yourself from potential legal issues while still providing the very best care possible. A significant concern for practitioners that I speak with is this gray area around the treatment protocols for chronic Lyme and co-infections. Long-term antibiotic use, integrative therapies, and patient-directed treatment requests can really expose you to the scrutiny from regulatory bodies. And some practitioners even fear that without clear guidelines, they're putting themselves at legal risk, especially when their patients don't show immediate improvement, or if they happen to experience treatment complications or Herxheimer die-off type reactions. You know, really, what you want to do is provide relief, alleviating your patient's suffering, but not at the expense of your license or their long-term health. So one of the keys here is transparency and documentation. You know, clearly outline your treatment plan, the potential risks and expectations for your patient. Always involve your patient in the decision-making process to ensure that they understand the complexities of their treatment. One of the things that I always like to point out is around 2009, the Institute of Medicine published a summary that really said, what is the state of medicine? They said about 9% of what we do in medicine has excellent evidence, and we should do that. And they said another 10% of medicine has pretty darn good evidence, so we should be following that. The other 81% of medicine, art. And so that's not to say that there's no evidence behind it, but the level of evidence is not that high that we can say definitively we do this. A full 81% of medicine, right? So this is not to say we should throw away the evidence-based guidelines and we shouldn't read the papers, but what we need to know is that a lot of what we're doing in medicine is exactly what some people are suggesting that shouldn't be done in chronic Lyme and other chronic tick-borne illnesses, right? So they're arguing that we shouldn't treat these people because we don't fully understand what's going on. If you were to take HIV or you were to take cancer, maybe when we didn't know fully what to do, people are like, oh, let's not do it. How about the recent pandemic? Did we say, oh, no, let's not treat these people? No, we said, let's do the very best we can. And as new evidence comes out, let's make sure that we incorporate that. One of the things that's interesting to me personally is that if you look at Lyme disease, there's actually more evidence of chronicity than there is for cure. And I would challenge anyone to find the papers that say otherwise. Maybe they decide that they don't like the medical evidence that's been published, but that's not real science. That's not real medicine. The art of medicine is using the best science we have and having an understanding of everything that's out there and putting our patient back at the center of treatment. Legal issues in here is this is one of the things I hear so many of my practitioners in the Lyme Disease Practitioner Certification and Mentorship Program, my LDPC training program, is that that's one of their biggest concerns. They want to do the best for their patient, but they also want to make sure that they protect themselves so that they're there for themselves, their family, as well as future patients. So this is one of the big things that gets into people's heads, which is why we have to address it. So now you're equipped with the basics of diagnosis and getting that proper diagnosis as soon as you can. We've talked about the importance in chronic Lyme of looking at co-infections and managing them appropriately so that you can actually make progress sooner when you understand that co-infection is actually commonplace. And then to calm your stress down and increase your confidence level in what you're doing, we want to protect your practice, right? So let's wrap up with some of our main takeaways. Understanding where to start, how to handle co-infections, and protecting yourself legally are critical steps in managing complex tick-borne disease patients. With these tools, you can feel more confident in treating these challenging cases. And if you're someone who's really looking for that next level of confidence, that next level of expertise, and you want to learn the nuances that are involved here and get one-on-one direct mentorship, as well as a community of peers and other blossoming experts just like yourself, I'd invite you to check out my Lyme disease practitioner certification and mentorship program. This is a 12-month training and mentorship program that was designed exactly to tackle all the challenges that we talked about today for practitioners just like yourself. If you'd like to know more, please check out the link below in the description. I appreciate you watching this video. If you found this helpful, please give it a thumbs up and subscribe to the channel. It does so much help for us getting this valuable information out to other people. And for those practitioners out there who are looking to raise their game to the next level and have the whole community around supporting you with one-on-one mentorship with me, then check out the Lyme Disease Practitioner Certification Program. And I look forward to seeing you next time.